I recognize the Attorney General.
I'm pleased to stand in the House today for the second reading of the Foundations for Promoting and Protecting Mental Health and Addiction Services Act 2019. And speaking after me, as the Minister indicated, will be Parliamentary Assistant Robin Martin. I'll just move over here for you. This Act has two schedules, the Mental Health and Addiction Centre of Excellence Act 2019 and the Opioid Damages and Healthcare Costs Recovery Act 2019. I'll be primarily addressing aspects of the Healthcare Cost Recovery Act 2019, Madam Speaker, but first I'd like to say a few words about our government's plan to build a mental health and addictions strategy for all of Ontario. As you may know, in the 2019 Ontario budget, this government committed to investing $3.8 billion over 10 years for mental health and addiction services and housing support. And this initiative is being led by the Minister who was just speaking. And I can tell you, when I speak to service providers in my riding, when he came up to visit and talk with them and engage, one of the leading experts in my area after the meeting, I said, what do you think about that? And she said, that was jaw-dropping. His engagement, his knowledge of the dynamic that we're dealing with was quite frankly jaw-dropping. That is the best term for it. This is a new approach for Ontario after the previous government allowed the system to deteriorate into extensive wait times, barriers to access, inconsistent quality, a lack of standardized data. You know, the previous government was just not on the ball on this, Madam Speaker. But our plans address these shortcomings, beginning with the building of a mental health and addiction system focused on core services, embedded into a step care model, and a robust data and measurement network. This year alone, Madam Speaker, we're investing $174 million to support community mental health and addiction services, mental health and justice services, supportive housing, and acute mental health inpatient beds. Ron Noble, who some of you will know, the CEO of the Catholic Health Association of Ontario, said, and I quote, "We appreciate the government for its commitment to invest in long-term care beds and funding for mental health, addictions and housing. These are significant commitments that will go a long way to improve the system and end hallway health care." And Camille Kenneville, CEO of the Canadian Mental Health Association, again, somebody who many of the members will know, she said, CMHA Ontario Division is delighted with the mental health and addictions care funding announced in the 2019 provincial budget. Madam Speaker, this is a positive step in the province's 10-year, $3.8 billion commitment to mental health and addiction services. We look forward to continuing to work with the province to enhance client-centred, community-based approaches to mental health and addictions in Ontario. My colleagues will be speaking in further detail over the next series of days about the Mental Health and Addiction Centre of Excellence, Madam Speaker. As a member of Barrie, Springwater, or Medonte, I'm encouraged on behalf of my constituents by this innovative proposal to improving Ontario's system of mental health and addiction services. This government has held extensive consultations across the province. And, Madam Speaker, all you have to do is look at social media to see the breadth and depth of consultations that Minister Tobolo has been doing. They're all across Ontario, in the north, in southwest, in the east, again in central Ontario where I'm from. And the engagement is deep in the sense that he's talking to people with lived experience, he's talking to people who are providing services, he's talking to people who are helping design systems and nonprofits, and leveraging the volunteer aspect of what's in our communities. It's the number of people that come around the table to talk and engage in the subject just speaks to the depth of the need in this province and the neglect that has been had by the previous government. 19 formal consultations across the province with mental health and addictions community organizations. Again, those frontline providers, hospitals, advocates, experts, again, people with lived experience. We had an individual in Barrie who was working at what's called the Sandbox Centre. The Sandbox Centre is an incubator. It's a space where businesses can collaborate and learn from each other. That's where we held our consultation. MPP Kanjan and I were jointly doing this. And as people were going around the table to introduce themselves, one individual, he was the third person to introduce himself, and he worked at the Sandbox Centre. And he said, "I'm not entirely sure why I'm at this table, but I think I know why." He said, I'm working here at the Sandbox Centre, and I've been working here for about a week. I think it was a week or 2 weeks, not very long. He said, but the real story is that I've been homeless for 3 years. And he then went on to talk about his lived experience, his interaction with the different agencies, with police services, with CMHA, with housing and hostels, and it was really, I don't think I can overstate it. It was quite gripping. The whole room just became so serious all of a sudden, and understood the topic that we were talking about impacts individuals' lives, that we have to get this right. There are people who have pathways, but they need a bit of help, and the minister knows that. And then when he responded and interacted with those types of individuals at the table, it was clear that he gets it, and that gives me great confidence in our government's plan to move forward. Everywhere we went and with everyone we talked to, Ontarians give us the same message. The system's too fragmented, the system's too confusing, the system's too hard to navigate, and the creation of the Mental Health and Addiction Centre of Excellence within Ontario Health, which will be a central engine for care oversight, this will address those concerns. It will develop, standardize, and monitor care across Ontario. It would help people and families access better and more consistent patient services and supports. It will help Ontarians in their mental health and addictions battles. Madam Speaker, I'd like to talk about Schedule 2 of the bill, in particular, the Opioid Damages and Healthcare Costs Recovery Act, 2019. But first, I'd like to begin with some difficult context on opioid addiction in Ontario and the reasons why we've made this a leading priority. According to a recent report by Public Health Ontario, the Office of the Chief Coroner, the Ontario Forensic Pathology Service, and Ontario Drug Policy Research Network, between July 2017 and June 2018, in that one-year period, there were 1,337 confirmed opioid-related deaths in Ontario. So I just want to pause there for a moment. When I talked about real lives being impacted, these 1,337 individuals that died in Ontario in a one-year period, we need to think not just about those individuals. We need to think about the people around them, about their families, about their siblings, their parents, their children, and how they're left in a system of disarray and lacking support themselves. Madam Speaker, it's really quite staggering. That's almost 4 tragic deaths every day in Ontario, and the collateral damage that goes with it. To put that into perspective, it's roughly the same number of people from across all of Canada that are dying each day from vehicle crashes, from alcohol or drug-related impairment. Shockingly, there's an estimated 46% increase in the number of deaths related to opioids between 2016 and 17. 46%. This, Madam Speaker, is an epidemic. It is a crisis, one that has cost the people of Ontario enormously, both in terms of lives lost and its impact on our public health care's front lines. Our government is determined to address this crisis. We are addressing this crisis. We're committed to addressing the physical, mental health, and social needs of individuals addicted to opioids, as well as combating drug use to prevent future addictions and overdoses. The Ontario government is embarking on a comprehensive agenda of policies and programs to address a dramatic increase in the opioid addiction and overdoses. There will be further action taken in the coming months, Madam Speaker. Ontario's priority has been transitioning to a new delivery model for consumption and treatment services, with an emphasis on treatment. These sites will provide life-saving overdose prevention and harm reduction services and connect people to treatment, rehabilitation services, and other health and social services. And make no mistake, the opioid epidemic is in part rooted in the overprescription of pharmaceutical drugs. Recent cases in the United States have reached this conclusion. United States municipalities, counties, states, they've all brought lawsuits against opioid manufacturers and distributors. Their claims are valued in the billions of dollars, the collateral damage of this. In August of this year, a judge in Oklahoma ruled that Johnson & Johnson had intentionally played down the dangers of opioids and ordered the company to pay the state of Oklahoma $572 million for the damage caused by the company. The judge stated, the defendants caused an opioid crisis that is evidenced by increased rates of addiction, overdose deaths, and neonatal abstinence syndrome. Ontario has been impacted by the opioid crisis also. Too many communities across Ontario continue to face an ongoing opioid crisis that is perpetuated by opioid manufacturers and wholesalers. All communities. You can go to a community now and talk to the community's leadership, and they will tell you their stats in relation to opioids. If I phoned the mayor of Barrie today he will tell me that we are the third highest rate of death per capita in Ontario. These are stats. We used to track economic statistics. We used to track employment statistics. Now we're tracking opioid death and opioid emergency statistics. We do need to track it, but it is a commentary on how prevalent this has become. It's not a big city or an inner city problem. It affects all cities and towns across the province. The crisis has meant that Ontarians have incurred tremendous costs. We've incurred healthcare-related costs, including inpatient hospitalizations, emergency department visits, specialist treatment for opioid use disorder, physician time and drug costs. And in my area, we have what's called a RAM clinic that needs resources that helps with this. We have overdose beds. We have the affordable housing is affected by it. There are just so many sectors are affected by this crisis. We've incurred lost productivity costs, including lost value of work due to premature mortality, long-term and short-term disability. We've incurred criminal justice costs, including police time, police work, courtrooms, corrections, expenditures for criminal offences partially or wholly attributable to the substance use. And we've incurred other direct costs, including fire and motor vehicle damage and workplace costs not included in lost productivity. These costs have had the effect of taking money away from our frontline health services. This is why the government is introducing legislation to enact the Opioid Damages and Healthcare Costs Recovery Act 2019. If passed, the Act would allow this government to sue opioid manufacturers and wholesalers for their alleged wrongdoing. It would allow us to recover past, present, and future healthcare costs due to opioid-related disease, injury, or illness. It would also create a series of special rules to assist the litigation process and support Ontario's participation in a national class action lawsuit that the province of British Columbia launched in August of 2018 against more than 40 opioid manufacturers, wholesalers, and others on behalf of provincial, territorial, and federal governments. This class action alleges that these opioid manufacturers and wholesalers failed to warn doctors and the public of the dangers of opioids, and they marketed them as safer and less addictive than other medications when they were not. This Act would also give Ontario the right to bring an individual or a multi-government class action claim in the future, if it decides to do so. Madam Speaker, we feel that joining the BC lawsuit, instead of launching our own, is the best course of action at this time. The BC-based national class action would be an efficient way of addressing the common issues among all the provinces, territories, and the federal government, and having the matter heard by the courts at once. Already, Alberta, Newfoundland and Labrador, and New Brunswick have announced their support for this lawsuit, and of course BC is leading the way. We understand that Alberta has publicly stated that it is considering similar legislation. Madam Speaker, we've heard questions surrounding how the recent filing in the United States of Chapter 11 bankruptcy by Purdue Pharma will affect our government's proposed actions. The company and its owners, the Sackler family, also recently reached a tentative settlement with 23 U.S. states and more than 2,000 cities and counties that sued the company over its role in the opioid crisis. But I will reiterate that the opioid crisis is unfortunately not limited to the border. It is not limited to the U.S., and it continues to have a devastating impact across Canada, with a corresponding extraordinary toll on our healthcare system to the detriment of Ontarian and Canadian taxpayers, let alone the individuals suffering through it. So while there may be a real desire on the part of Purdue entities and members of the Sackler family to achieve, quote, global resolution, any proposed agreement ought to account for and include payment for the Canadian claims which are presently advanced in a structured and consolidated manner in a national class action commenced in British Columbia, of which Ontario is a part. We will continue to assert our claims against the Purdue entities and the Sacklers to ensure that Canadian jurisdictions are fairly and reasonably addressed in any proposed settlement in the U.S. We will not be content to simply permit the U.S. settlement to proceed with no appropriate approach and consideration for Canada. Ontario remains ready and willing to participate in the reported effort to achieve global resolution of the claims against Purdue and the Sacklers. If, however, Ontario is not included in this process, we are determined to continue to pursue our claims to the fullest extent permitted by the law on behalf of Ontarians. And finally, Madam Speaker, I'm sure that some are wondering what the province of Ontario would do should this class action lawsuit be successful and the government be awarded money and damages. Let me assure you, the members of this House, all Ontarians, that this government would invest any award from this litigation directly into frontline mental health and addiction services. Madam Speaker, that gives you a sense of where we're headed with the litigation. It gives you a sense of the importance of what we need to do as a province. And I want to reiterate again, when we talk about litigation and when we talk about where we're going with the bill, should it pass, it's always rooted back in the individuals that have really incurred the life-altering and sometimes death experience. It's just, it's heartbreaking to talk to the families that have children who are caught up in opioids addictions. It's not I don't feel permitted to tell their stories per se, but you hear them from individuals, and again, it's heart-wrenching. And it's not acceptable. It's not the kind of Ontario that we want to live in, and I couldn't be prouder to stand with my colleagues and support this bill so that we can move forward and deal with the crisis and stand behind the Minister of Health and the Parliamentary Assistant, Martin, of course, but Associate Minister Tobolo, and just the excellent work that he's doing to move us all forward. Thank you, Madam Speaker.